I'm Dr. Terry Simpson for your doctor's orders, and I want to talk a little bit about the Affordable Health Care Act, also known as Obamacare, now that the election is over and what it will mean. Because one of the myths that was going on out there was that by expanding the pool of insurance, that those individuals would overwhelm an already overwhelmed system, waiting times would increase, hospital costs would increase, and this would cause more medical inflation. And in fact, exactly the opposite will occur. When we look at SouthCentral Foundation, which is a primary care center for Alaska Natives in Anchorage, we have seen how this has worked. Those individuals have no barrier to health care, no copays, no deductibles. They are promised same-day access to their primary care physician for anything that they can. In addition, they can have same-day access to the pharmacist, to the midwife, to the dietitian, and to the behavioral therapist. As a result of this, access that was granted and same-day access, for which, by the way, SouthCentral Corporation received the Malcolm Baldrige Award last year and has been written up a couple of times in the New York Times. As a result of that, costs have gone down. This is a closed system, so they can measure costs. Emergency departments visits have dropped by 50%. Emergency departments are far more costly than seeing a primary care physician. Specialists have dropped by 50%. Specialists, as you know, are far more expensive than seeing a primary care physician. Hospital days have dropped. As you know, hospitals are far more expensive than seeing a primary care physician, and visits to primary care physicians have dropped. It turns out that when people have access to their primary care physician when they need it, they utilize it. And by utilizing it, they are able to have preventive care and avoid overutilization of a hospital. Expanding the pool of people with insurance actually decreases the burden of health care. Here's the reality. People get sick whether they have insurance or not. The earlier that we can treat their illness, the less expensive it costs the entire system. It's far better to treat a pneumonia in a doctor's office by giving a prescription for antibiotics than by having the person show up in the emergency department and need to be on a ventilator. So, in spite of what people might say that this will cost the system, we actually have very good proof in a system where people don't have to pay a thing for health care that they actually cost the system less. Can this model system be used in other communities and other states and with other systems? Absolutely. And in fact, SouthCentral Foundation is being looked at in their system of healthcare by a number of other systems around the world to do this. By opening up more, allowing more access, reducing the cost to that person, you actually will decrease healthcare. I'd be interested to hear your comments. For your doctor's orders, I'm Dr. Terry Simpson. Good day.